colleagues, a very good afternoon and warm welcome to the Town Hall. We have been working from home for the past 5 weeks already. Time really flies. I hope you and your families are keeping safe and well and have adapted well to the new ways of living and working. The purpose of this Town Hall is to hear from you and to provide the opportunity to ask questions and raise any concerns. Thank you for sending questions in advance. Please also use the comment box to send questions if you would like to do so during the town hall. I would like to welcome my colleagues, Gita Sabarwal, the RC for Thailand, as well as Daniel Kertes, the WHO representative, Neil Bune, DCO Director, and Dr. Teolisa, our medical officer. They will help answer questions later on. As you know, we have put in place a working from home modality until 30th of April. At the next CCMT, next Tuesday, 28th April, we will take a decision based on the evidence, additional information from our host country, as well as whether our officers are ready and prepared to ensure we have a safe environment. After that, an SMT will be held and staffs will be informed about their decision on whether to extend the working from home modality. What has CCMT with the support of the entire UN system been doing in the meantime? I would like to share some of you. We continue to work to find the best way for staffs to stay safe while meeting the heightened responsibilities we have at this time of crisis. We come together once a week. That is every Tuesday morning. We are in close and constant communication with the government through RC Gita as well as through WHO Daniel Kertes. We are reviewing across all UN entities how we can gradually and safely return to office. Likewise, we also have strengthened our communication to staff with newsletter and updated information regularly. We have psychosocial support in place, which will continue as long as necessary. To address the urgent need for psychosocial support at this current time, on 10th April, so since 10th April of this month, Mr. Craig Gagnon has rejoined ESCAP team to provide counseling services virtually. So I welcome all of you to benefit from his service. Appointments and other arrangement can be sent through email to the ESCAP Medical Services. The information is available in the website. And the COVID-19 helpline, as all of you know, has been in operation for the past 3 weeks already. And this helpline is available to all UN entities, and we have 32 dedicated staff from 13 UN entities monitoring the calls. The helpline now has extended also its support to the government, to also support the request for different language support on the 1422 hotline, which is administered by the DDC or Department of Disease Control. As of yesterday, about 30 UN volunteer staff members have been nominated to support the hotline. And last but not least, on the lighter side, during this difficult time, of course, it is very important to think about our well-being. I'm very pleased to learn and to share with all of you, for those who have not have received this information, that there are so many initiatives, yeah, on staff well-being, including one, yeah, that for this I would like to especially thank Kun Nitaya and the Staff Association Thailand, who have organized virtual staff association exercises. I understand one of these exercises is this Zumba dancing, yeah, which gain uh, popularity, yeah, and many people attending, which takes place every Tuesday and Thursday in the evening. Yeah, so with that light note, I will now hand over to Daniel Kertes to provide a situation update on COVID-19. I will then open the floor for Q&A, which will moderated by Gita. Over to you, Daniel.
Thanks so much, Ibu, and hi, everybody. Daniel here from WHO. Just wanted to give you a quick situation update on COVID. We're now 115 days since the first notification of COVID-19 in Wuhan. And I think we've all been shocked at how COVID has affected the world in just 3.5 months. We now have over 2.5 million cases. Many of us come from countries that have been severely affected, and it's been really difficult to watch. I know that you're all following the situation in Thailand closely, and you've all noticed that the number of cases actually seems to be leveling off, even decreasing. And fortunately, we just haven't seen a sustained steep rise in confirmed cases anywhere in the country. And I know that some of you may be particularly concerned about what is happening in the provinces where you may have friends and family. COVID has been reported in 68 provinces. And outside of Bangkok, we've seen bigger outbreaks in Phuket, Yala, and Chonburi. This continues to be worrisome, but there is good news in that currently only 14 provinces have reported any cases in the past 7 days. And in all provinces, case numbers seem to be stabilizing. So many of us are cautiously optimistic about the situation in Thailand, but not too optimistic. It's important to remember the biggest lesson we've learned about this virus over the past 3 months in places like China, Spain, Italy, and the United States. Cases can increase from a few scattered ill individuals to hundreds, even thousands in a few short days or weeks. Even now in Singapore and Japan, which were thought to have controlled the virus, we're seeing steep rises in case numbers. We need to always remember that this virus has explosive potential to overwhelm quickly even the world's best health systems, anytime and anywhere. So one strategy to slow the pandemic that's been used around the world are what we call public health and social measures. And these include the lockdowns, shutdowns, movement restrictions that we've been living, including the work from home arrangements. Now, these social measures are all meant to ensure that we keep a safe distance from each other to protect ourselves and those around us from infection. And there's no doubt that these measures have contributed to slowing the epidemic in Thailand. And the efforts that you all have made in staying at home and restricting your movements have contributed to the control of the pandemic in this country. And I talk about these public health and social measures because the Thai government is talking about easing them. And we're talking about possibly returning in some form to our offices. And it's completely appropriate to begin to plan this. People need to get on with their lives. They need to get on with earning their livings, educating their children, socializing, etc. From our informal discussions with the Ministry of Public Health, it looks increasingly like some of the measures will be lifted, possibly beginning in May. But this will have to be done in a very careful and deliberate way. And WHO has issued some very clear guidance on this, which we've shared with the Ministry of Public Health. But any lifting of restrictions will have to be slow and it'll have to be phased. Not all restrictions can be lifted at once. Probably some, followed by a period of 2 weeks to see the impact, and then perhaps followed by more. Lifting of restrictions will have to be strategic. Some activities are clearly more risky than others. Bars, indoor sports events, nightclubs, restrictions on these would probably be the last to be brought back, if ever, until we have some sort of permanent solution to the COVID problem. And each workplace, shop, or public place will need to have measures that ensure a physical distance of between 1 to 2 meters between individuals. In lifting these movement restrictions, these measures, every country, including Thailand, will have to be very, very careful. The tough reality is that we're not going to be able to eradicate this virus. As Thailand lifts restrictions, risk from the virus will remain. So lifting restrictions doesn't mean that we can return to our pre-COVID lives. It'll be a new balance between the risks of COVID on one hand and the need to live intermittently with measures that impose a physical distance, like working from home, on the other. We will likely be cycling in and out of these measures in response to local outbreaks of disease, and this may go on for months, possibly years. As we lift restrictions, we'll need to pay special attention to what we can do as individuals to fight this virus, to slow this pandemic. And those are the basics that we've always been talking about. Frequently washing your hands with soap, water, or an alcohol-based hand rub. Avoiding as much as possible touching your eyes, nose, or mouth. Sneezing into your sleeve or a tissue, and keeping a distance of at least a meter from others around you. These 4 basic measures are so critical, and they will protect you and others from COVID-19 and a host of other nasty infectious diseases like flu or the common cold. They will be extremely important to pay attention to as restrictions are lifted. I think the overall outlook is positive, believe it or not. There is a huge global effort underway to find a vaccine or a treatment, and this will come. Our lives will eventually return to a situation where the virus poses minimal risk, but it will take some time. I'm very happy to answer any questions that you have, either as part of this forum or offline at any time. But I do just want to end with a plug for the flu vaccine. I highly recommend that all of you and your families get the flu vaccine. Now, the flu vaccine won't protect against COVID, but it will protect against the flu, of course. And flu and COVID look a lot alike. Flu puts a lot of stress on the health system, especially in the rainy season when it tends to be worse. And we suspect that COVID actually might be worse as well in the rainy season. We want to do everything we can. We all want to do everything we can not to have to go to doctors or hospitals and not to burden health systems at this time. Plus, of course, having flu is miserable and nobody wants it, and the flu vaccine is pretty good. So that's my medical tip of the day. Get the flu vaccine, and I'll end there. Thank you very much. And back to you, Ibu.
Yeah. Thank you very much, Daniel, for your updates regarding situation in Thailand, latest situation in Thailand, as well as the importance of the key measures that we need to uphold, including individual measures to keep ourselves safe. Now I would like to open the floor for Q&A. I would like to invite RC Gita to moderate the session. Over to you, Gita.
Thank you, Ibu Amida. Dear colleagues, thank you to all of you for staying strong and for your efforts to support each other and the UN family during these challenging times. We will go into the Q&A session now, but I would first like to emphasize my deep appreciation to the UN family that has come together to assist initiatives we've quickly put in place to provide support for our colleagues in a spirit of shared solidarity and responsibility. The helpline, as you know, has been a big success because of the wonderful volunteers who stepped up immediately when it was needed the most, ably facilitated by the heads of agencies. I personally have been here for just over 5 weeks, although it seems a lot longer. And most of my time has been working in this, working from home modality. It has not been easy, as I'm sure many of you have also been experiencing. I think it's imperative that we all reflect on the importance of maintaining some work-life balance during these extraordinary circumstances and ensure we promote healthy mindsets. I would like to thank the UN agencies who have teamed up to help us promote messages to this effect for our staff and in the country more widely. In these past weeks, I've set about establishing and strengthening relationships and partnerships needed to manage the COVID crisis and response In working with the government, the Ministry of Foreign Affairs is a key counterpart and have been in regular communication on a range of matters important to the UN family here in the region. I think we have a strong foundation and we look to recover and indeed build back better from this crisis. With that, I would like to now open the floor for questions. Please send in your questions via the chat function as directed, and we will ensure that they are taken up and addressed. We will also ensure that questions that are received that we do not have time for here today are answered by early next week. I'm going to begin with our first set of questions that you had sent earlier today. The first set of questions relate to return to office. Ibu Amida, you might want to step in here. The first question is about, will the working from home modality be extended beyond 30th April? Over to you, Ibu.
Yeah, thank you very much, Gita. And also thank you very much, for all the various questions that have been sent from all of you. And I understand the team, understand that there is this concern, of when, and not only when, and how, we are going to return to work to office, not to return to work, but to return to work to office. Most importantly is, of course, the concern for staff's safety and well-being. So with that in mind, of course, CCMT, I mentioned earlier, that we routinely discuss, monitor situation, discuss, all the concern, all the measures that needs to be taken, and also how to develop, anticipate, right, the various development, including, how long we need to work from home, and when and how, if that time arrives, how best we can prepare, right, to return to work in office, But again, to respond to your question quickly, and then I will hand over to Gita for other colleagues also to address the question at more length. So several principles, for us to decide whether to extend the work from home or vice versa, to return to work in office is basically, one is the continued risk assessment analysis of the situation, whether, again, Daniel earlier alluded that but numbers looks quite promising, but it doesn't guarantee anything, so that's why we need to keep on monitoring the situation and do this risk assessment, whether government undertake all the necessary measures and so on and so forth. Second is to align as much as possible with government policy and response. For example, we understand that government also is considering opening up, but in stages, not all over the place, the same measures in the whole Thailand, but different measures and in stages. Third is, of course, but this is the number one, is to ensure the safety and healthy of staff, in the sense that also the work environment, including when staff commute to work and using public transportation and so on and so on, how to ensure the safety and healthy of staff. And again, a third is what Daniel already alluded earlier, and keep re-emphasizing, is the importance of individual measures, personal hygiene, social distancing, and so on. So with that, several, 3 or 4 basic principles, I hand over to Gita. Back to you, Gita.
Thank you, Ibu. The next question is, will the return to office be voluntary and up to individuals to decide whether to come to office or work from home? Daniel, would you want to start, and then we can get Ibu and Anne to step in?
About whether the return to office would be voluntary?
And up to individuals to decide whether to come to the office or work from home.
Yeah, I'd probably leave that question to Anne. I think what we need to do though is make sure that the office environment ensures that there is the possibility for staff to be adequately physically distanced from each other in the work environment, and that there are facilities again for all the things that we talked about. Clearly, we have facilities for hand washing, but to have things like alcohol-based hand rub on hand. And that sort of thing. But I think that the really critical thing will be to ensure that in all in all the different steps that we take during the day, that measures to ensure physical distancing are provided for.
Thanks, Daniel. And do you want to step in?
Sure, I can perhaps add a little bit to that. Good afternoon. For those who don't know me, I'm Anne Matthews and I work with Ibu Amida at ESCAP. I think the question on voluntary, I know, and I will speak to some of my staff challenges. We're all in a very different situation with COVID. Some of us have been forced at home to look after our families, homeschool our children, look after our parents. And we have a lot going on just apart from work. And I know many people are nervous about the school systems. There have been some announcements about when the schools will open again. And this is putting an awful amount of pressure on people. So I'm assuming the question, because it has been posed to me before, is, will I be made to come back to the office? How am I going to cope with my home life, which is a very different life now, and also my work life? And I'm sure that all your management team will support you if it is not possible for you to return. We do have flexible working arrangements in place for the United Nations for all, and I think we should leverage those to support those staff who may be in a little bit more challenging situations and unable to return immediately to the office. Thank you, Geeta.
Thanks, Stan. The next question is, are there different plans for those who commute via their own vehicles versus those who take taxis or BTS for returning to office? Anne, would you want to step in again on this?
Certainly. We heard Daniel very loud and clear, and he talks about social distancing. And it's about social distancing everywhere. It's about us catching a BTS. It's about us catching a very small bus to the work. Many of us ride motorbikes. And maybe these mechanisms that enable us to get to the office don't practice social distancing. So as the CCMT have put together a task force, which will work with the operations management team, we will have to look at what that means in terms of commuting to the office, because we are aware there are some measures that will need to be put in place, Geeta. Thank you.
Thanks, Dan. Thanks a lot. There are a couple of medical related questions that I'm going to ask Daniel and Dr. Theolisa to come in. The first is, can the virus be transmitted from an asymptomatic person?
Yeah, that's a really good question. It's $1 million question. I think it's, again, one of those things that we're working to find out. What is the role of people who are asymptomatic people who are infected but asymptomatic in this pandemic? Let me just define what that is. Somebody who is asymptomatic would be somebody who from whom the virus has been identified but who doesn't demonstrate any symptoms. And there have been studies that show that some people are asymptomatic. But what's really interesting is that they're asymptomatic at the time that the swab is taken or that the study is done. A lot of them then go on to be symptomatic, and they may just have mild symptoms, but they do go on to be symptomatic. It is looking like there is a period of about 2 to 3 days before most people become symptomatic when they begin to be infectious. And we call this the pre-symptomatic period. But what we really learned about this is that this pandemic and most of the transmission is driven by people who are symptomatic. And that really makes sense, doesn't it? The more you're coughing and sneezing, the more likely you are to transmit the virus. So somebody who is mildly symptomatic or asymptomatic may transmit to one other person, or maybe not to anybody. But someone who's coughing and sneezing everywhere has the potential to transmit to 3, 4, 5 other people. So the answer to the question is it's possible that asymptomatic people may transmit, especially in the few days before they actually develop symptoms. But we think that most of the transmission, most of this pandemic, that the transmission around the world, the transmission that's driving this pandemic is occurring in symptomatic people. That is, people who are coughing, who have fever, etc. Over.
Thanks, Daniel. There's a related question about antibody testing, and it'll be great if you come in. Will there be any antibody testing once the building partially opens to some staff, since we will have been out for a long period? Would you want to answer that and allow Teolisa to come in as well, Dr. Teolisa to come in as well?
Sure, I can answer that. That's also a really good question. I think the whole issue about antibody testing is really a way to find more rapid and accurate tests for COVID. Right now, antibody tests, for a whole bunch of technical reasons, don't really have a role in diagnosing acute infection. So if you're sick and you want to know whether you have COVID, the best thing to do is go and get the standard nose and throat swab and do the standard PCR test, as we call it. Antibody tests may have a role in the future in determining the percentage of the population, because antibody tests measure something different. They don't actually measure the virus. They measure a person's response, their antibody response, their body's response to the virus. It really tells us whether or not a person has been infected at some time in the past with the virus. So these, doing antibody tests at a population level might be useful in helping us determine immunity in the population as we try to decide how many people in the population have had the virus. But for other technical reasons, they're not particularly useful in making acute diagnosis. And they're not right now, the tests that we have now are not particularly useful in determining whether or not someone is actually immune. So right now, WHO recommends these antibody tests pretty much exclusively for research purposes until we have better assays. Over.
Dr. Teolisa, would you like to step in?
Hi, good afternoon, everybody. I'm Dr. Teolisa Almendras. I'm the ESCA medical officer. In terms of the context of using the antibody testing in determining who can go back to work or not, New York is looking into the possibilities of using this antibody testing. But as yet, there is no definitive guidance on how this can be used in the context of identifying who can actually go back to work on the basis of whether you test positive or negative to the test. Thank you.
Thank you, Dr. Teolisa. Stay online. The next one is for you as well. Can we get the flu vaccine from the UN Medical Center, or should we have to go to a hospital? You are muted, Dr. Teolisa. You need to unmute yourself.
Sorry. Yes, we do have the flu vaccine in stock right now, but of course we are challenged with how to administer that to staff. My personal opinion and professional opinion would be, if you have a comorbidity, especially if you have diabetes or if you have other chronic illnesses, don't wait until medical service provides the flu vaccine to you. it's already readily available at all local hospitals in Bangkok. So you can actually go to your healthcare provider, get the flu vaccine, and not wait until the ESCAP premises open again.
Brilliant. Thank you, Dr. Teolisa. The next one is for you as well. Is it true that the BCG vaccine mitigates the impact of COVID? If so, would you suggest that adults who have not received the BCG vaccine get it? And Daniel, you can step in as well here. Over.
I think Daniel would be in a better position to respond to that.
Daniel, do you want to step in?
Yeah, the answer is no. It doesn't, and that there's no reason to get the BCG vaccine at this time for protection against COVID.
Brilliant. Thanks, Daniel. We've got a logistics-related question. If we have to work from home for more time, can we get our office equipment delivered to our houses? This includes things like monitors and chairs, etc. Anne, would you want to comment on this?
Good afternoon. So I can't speak for all the UN, of course, but I can speak for ESCAP. And some staff members, you know, don't have big monitors at home or may not have the best of chairs. And so they have asked us whether they could take their monitors or their chairs back. And there is a process in place. Your admin assistants can contact Khun Nok, and there is a way of getting your chair or your monitor back to your house. But you have to fill in a security form because you know it's a UN asset. So yes, I can't speak to all offices though, but I can for ESCAP. Thank you.
Thanks, Anne. And the next one is for you as well. It's about the air conditioning system in office. And it says that the air conditioner at the office is a central system. What is the measure in place to avoid spreading of the virus if there is an infected staff who gets into the premises?
Yeah. So I can speak to the ESCAP premises, and for those who may recall, you know, 5 weeks ago, we've put in several measures in terms of preventative measures. The first thing is that we do thermal screening and we do a visual check on everybody coming into the building. We unfortunately have had to turn people away because they've had, you know, a relatively high fever and send them to the hospital. Secondly, we've had a lot of messaging to staff. If you don't feel well, if you wake up and you don't feel great, don't come to the office. So we've built a lot around messaging and communications in terms of don't come to the office if you don't feel well. Secondly, in terms of the air conditioning, we have actually done a study with the International Labour Organization in the past 3 months. And what I understand from our engineers, although I'm not an engineer, we have almost hospital-like filters in both of our buildings. And so those filters are able to filter out, you know, certain air particles. Whether it would filter out a COVID, I don't know. But what we would do is we will get this response back in writing to everybody so that we have the right technical answer. But to respond in general, yes, the air conditioning and the air quality in the ESCAP premises is probably far safer than the air quality outside. And then finally, what we are doing is that we will have air quality monitors. We still have the hand sanitizers. We've been doing deep cleansing in everybody's offices whilst you're away. And we have alcohol-based cleaning materials now, cleansing materials for the offices. So it's not just one measure, but it's putting in multiple preventative measures to ensure that our staff remain safe. Thank you.
Ita, can I come in here just for a second?
Sure, sure.
So I think that's an important question to address, and I think it's really important to that we all understand how this virus is transmitted from person to person via the respiratory route. You know, when you sneeze and cough, there are these little droplets that come out of your nose and mouth, and if you're infected, the virus is in these droplets. These are sort of heavy droplets, and they generally settle within a meter of your sneeze or your cough. And that's really why we recommend this distancing of at least a meter, so that you're not in the range of the spray that comes out when people cough or sneeze. When we talk about the virus circulating in the air, we're talking about the virus circulating on aerosolized particles. These are much, much smaller particles than the ones that come out when you sneeze or cough. And what we've found, what studies are currently showing, is that it is possible that the virus attaches itself to these tiny particles, but these tiny particles are generally only generated in very special circumstances, generally in healthcare settings, where you're trying to make you're either intubating a patient, you're manipulating the respiratory tract of the patient, and that's when these small droplets that have the potential to circulate in the air are generated. It's not thought that these kind of particles are generated in normal circumstances, and we don't think there's a risk from getting COVID from the air that you breathe in say, an office building or through systems like air conditioners.
Great, thanks, Daniel. We've got a question on contact tracing apps. Has management considered having staff use contact tracing apps on their phones to assist us in monitoring after we being a phased return to office? Daniel, would you like to start? And then probably we can see if someone else wants to step in.
I don't know the answer to that. I think it's a good question. I mean, you would only need to be traced as a contact if you were a close contact, and that has a very specific definition, a close contact of a case. And in that case, in the situation where you were identified as a close contact of a confirmed case, you would not be in the office. You would be quarantined somewhere, likely at home, and you would be monitored every day. And I'm not actually sure how the ministry is doing that, whether they're doing it by phone or whether I think they are actually doing it by some sort of app. But it would be a situation where you would be monitored under the auspices of the Ministry of Health in a quarantine setting. Over.
Brilliant. Thanks, Daniel. I'm going to ask Neil to step in on reporting, protocol-related reporting. Neil, the question is that do you have any statistics on COVID-19 cases among UN and specialized agency, including staff, worldwide and in Bangkok specifically?
Yeah, just to say that, I mean, there's a lot of diversity amongst the countries in our region on the situation on how's reporting. So I think that the Secretary General just in a message yesterday gave some advice on this. And what he said is he receives daily reports regarding the number of UN personnel who've been infected with coronavirus. And yet we know those numbers are not complete. So in effect, the numbers are, the best numbers are actually in New York right now, even though we know they aren't complete. And then I think it's important also to recognize that we're trying to also change the way we report those numbers so that there is a more complete picture in New York, which we can access if needed. And there is this new reporting system that the Secretariat, UNICEF, UNDP, the World Intellectual Property Organization, the Atomic Energy Agency, UNFPA, and UN Women are in. And we have an additional protocol for agencies here in Bangkok that are not part of that global agreement, where they report through a mailbox in Dr. Teoleza's office, so that we can capture the Bangkok overall situation, but to do it in a way that fully respects the confidentiality of staff.
Thank you, Neil. Daniel, the next question is for you. Once staff gradually return to the office, what are you planning to do if there will be a second or a third wave of infection in Thailand?
Right. That's really part of that. That's sort of what I was talking about a little bit in my opening brief. Is that, as we return to the office, we'll be, and as Thai authorities lift some of these public health social measures, these movement restrictions that we've been living, as those are lifted, we sort of lose one of the most important weapons we have against the pandemic, and we'll always be living with a risk because the virus, of course, will still be there. We don't have any new weapons against this virus now that we didn't have a month or 2 months ago. So we'll always be living with the risk of this virus, and our lives will be sort of this balance between these restrictions, which help us social distance, and the risk of the virus. So it is possible that as we lift some of these restrictions, the virus comes back, and you can call those waves or think of them however you want, but it's quite possible that the virus would come back, and in that case, one of the things that would have to be considered would be the reimposition of these measures which encourage us or force us to keep a distance from each other. So it will, our lives in the near and medium term will be sort of cycling between the virus, which will wax and wane, and these measures which will be imposed in order to combat the virus, because it is one of the only weapons we have.
Brilliant. Thanks, Daniel. And the next one is for you. Once the UN building opens up again, what measures do you have in mind to minimize the risk of infection in common spaces, including canteen, elevators, amongst others?
Thank you for that question. So just to kind of reiterate, if you recall, we talked about how do we move back to an office. And Ibu Hamida talked about the different risk assessment model that we have to go through to decide when we go back to the office. So a task force has been put together, and they will work with the operations management team. It consists of colleagues from UNICEF, ILO, WHO, UNDP, and also ESCAP, to look at how we would gradually return to our office. And I think it's important to note that our office means different things to different people. So some of us live with our counterparts in the government. Others, we are in a rented building, and some of us own our own premises. So some UN officers may be ready to start returning to an office, while others may not be. But regardless of the environment, we need to ensure that we have, an office that is safe. And we're going to do that through an evidence-based risk assessment on how we return to the office. So what are some of the risk assessment activities that we're going to have to look at from an operational perspective? We'll have to look at the meeting rooms. We'll have to decide what social distancing means in them. We're going to have to look at our space around our desks. How close are our desks? Do they need to be further apart? What about the elevators? At the moment, if you're in the ESCAP UN Secretariat building, it's quite crunched in the mornings and at the lunchtime. That won't be able to happen. How are we looking at our eating spaces? We're already starting to work with our vendors on that. How do we social distance around that? And I think the final thing is, from a personal perspective, some staff, may have underlying health issues, and it might be better for them to continue telecommuting. And as I'd said before, there are others who have children who they may need to homeschool for a while, so they may need to continue telecommuting. So I think when we look at all of this, we will have to come up with an action plan that will look at probably a very more gradual and phased approach to how we return to our offices. So to summarize, this will all be done in collaboration with all the UN entities. One shoe doesn't fit all. We all have different office space, but we certainly have to make sure that it's safe for all of us, and that we have put in the correct preventative measures to ensure we reduce our risk of COVID. Thank you, Geeta.
Thanks, Anne. We've got two questions on schools, on schooling, and I'm going to ask Nicole to step in here. The first question is about, has the government made any announcements about opening international schools? The second one, Thai schools remain closed until 1st of July. Is there a possibility that they will open sooner? Over to you, Nicole.
Thank you, Geeta. Good afternoon, everyone. Nicole Eggers-Westermann, HR and ESCAP. On the opening of the international schools, the international schools are considered open at the moment, right? They are in a similar situation than we are, that they are physically closed while learning is ongoing in a remote setting. There has been no further communication on how this will continue, and I understand that international schools will make the determination respective to their individual situation, because we are talking about schools that might be also in remoter areas where cases are less prevalent, and also obviously under consideration of the ongoing decisions of the government regarding a state of emergency or openings. I think it's very, very clear that we have to be mindful of all the challenges that are faced by our staff members with having children at home. And Anne already indicated that, I think twice now, that we are very mindful of it, and we also discuss it with all managers, and we let everyone know to please show the greatest flexibility and understanding to everyone in the situation, and be also very flexible on working hours distribution, right? Some of our staff might not be able to work during the day so much, but rather are willing to move their working hours into the early morning hours or late evening hours. So I ask all managers to be very, very flexible on this. And if you have specific questions, always reach out to HR, and we help you in addressing situations. I think, Geeta, the next question was on the local schools, right?
Right, that's right.
Yes. So the last information we have on the local schools is that they are closed through July, and there has been no additional information. And again, there also, I understand that staff are concerned regarding, you know, an eventual return to the office, and the situation that then you still have children who cannot go to school. So again, there will be utmost flexibility, and those staff members might have to continue working remotely.
Thanks, Nicole. Staff Association has provided a process for donations to canteen staff. Will a similar process be made available for Doi Tung staff? And would you want to come in here?
Yes, certainly. You know, one of our challenges has been, you know, to manage the whole process of no work for our contractors. So we have been managing our contractors and trying to be as flexible as we can within the UN rules and regulations. And thanks to our staff association, they made donations for what we call our coffee den ladies. And the other vendors, they are what we call income generating accounts. So they actually generate income for the UN. So during this period, we have invoked the force majeure in the contracts. And so organizations such as Doi Tung are not paying rent at the moment. Typically what we try to do is we try to help the foundations or the vendors find other positions for their staff, because really they become quite like our own UN colleagues. And it has been very unfortunate and quite tough on many, because everything is closed. So they couldn't relocate many of those staff. But we have made it in a way that the foundation has minimized its overhead costs during this period. So thank you for that question, and thank you for thinking about our colleagues in Cafe Doi Tung.
Thanks, Anne. Daniel, the next question is for you. Would WHO consider recommending to the government a mass flu vaccine drive across Thailand? Oh, have we lost Daniel? No.
Now we will. Very good suggestion. I think that you know, the Thai Ministry of Public Health is very aware of how much a burden flu is. And certainly in Thailand, the flu vaccine, as in many jurisdictions all over the world, the flu vaccine is recommended, but it's really recommended specifically for target groups like those older than 60, 65, young children, and people with chronic conditions, diabetes, heart disease, and lung disease. Very much the same target group that is affected by COVID. So certainly vaccinating these people across the country would be really, really critical. For planning purposes, I'm not sure that countries stock enough vaccine for the whole population, but I think it's something we could discuss with the Ministry of Health. I think it's a good idea. Over.
Thanks, Daniel. Daniel, there's another question for you. How is the WHO validating epidemiological data on the COVID-19 situation in Thailand?
So what we try to do is that we want to make sure that everything is in place and that we've made all the recommendations that we need to make to ensure that we're not missing cases, because I think that's really what the concern is. Are we missing cases of COVID out there? And I think the question is not really whether or not we have 15 cases or 30 cases or 40 or 50 cases. It's, are we missing big pockets of community-based transmission out there that may be driving an epidemic that we're not seeing? And so what we've been doing is working with the Thai government to ensure to implement a couple of things. And we know that the testing capacity, the capacity for testing in Thailand is increasing. The aim is to have one lab testing in every province by the end of this month, and 400,000 tests per month in Bangkok, and 400,000 tests per month in the provinces by the end of the month. So the capacity for testing and finding cases out there is increasing. The Thai authorities have also increased, they've changed the case definition so that the eligibility for testing is now much broader than it has been in the past, so that more and more people will be tested. And there have been some studies that have been done in sort of community-based settings, looking around where there have been outbreaks, and those studies have found about a prevalence in the population of about 1 to 2%. So I think that the numbers, while we may be missing some cases out there, I don't think we're missing, based on what we're seeing, big pockets of community-based transmission. Although we need to keep monitoring the situation and keep ensuring that that there's enough testing going on, and maybe pushing that testing out more into the community to make sure that we're picking up any evidence of more widespread community-based transmission. Over.
Thanks, Daniel. In the same vein, there's a similar question around dormitories here in Thailand. Given the experience in migrant labor dormitories in Singapore, has Thailand started testing in similar dormitories here? Daniel, you are on mute.
Sorry about that. I think that's a good question. That is a good question, and I don't know whether they've actually specifically targeted these areas. What they have done is they have identified geographical or physical areas where clusters of cases are occurring, and then they go into the population and they test on a sort of a massive scale anybody in that population. So that's in a way a sense of getting a sense of that's a little bit more of a targeted approach to where there may be more community-based transmission. Over.
Thanks, Daniel. And the next question, and in fact, this is the last question that has come in, is about the Open Plan Office. Given that ESCAP is planning an open plan layout even before the COVID-19 outbreak, staff still have not heard a solid rationale for implementing Open Plan Office at ESCAP, and today they are even more concerned considering the risk of contagion amid the COVID-19 outbreak? What is the view of WHO and the CCMT on health-related issues to open plan offices? So probably Daniel, Dr. Theolisa, and Anne, the three of you could take the question. Anne, you are muted.
Would you like Daniel to go first?
You can go first. You go on. Daniel can come in towards the end.
Okay. All right. Thank you. So for those who I think the main question around this is open space safe, and what are our intentions for the future ESCAP premises? So, you know, in the context of COVID, open space, the challenge we have there is to make sure that we have enough space around everybody, right? And we've heard Daniel say at least 1.5 meters. So it is true, we are going to have to revisit our open space design to ensure we take into consideration the COVID requirements. If you think about open space today, many of our colleagues already sit in open space, many of them. So the guidelines that we're going to be looking at is coming up with a solution about the entire premises, your desk, the hallways, the elevators, your catering space, your meeting rooms. How is that going to all look so that we ensure during this period before we can get a vaccine for COVID that you have the necessary social distancing? For those who may not know, we had a very long workshop this morning with all our colleagues in the UN entity, and we did discuss revisiting the open space design and revisiting and ensuring that once we have put in the necessary guidelines, that these will be, the new future open space will be aligned to ensure that we take into consideration COVID. I hope that answers people's questions.
Thanks, Anne. Daniel, would you want to step in, or should we move on to the next question?
Maybe just briefly, I think Anne's sort of hit it on the head. It's really, again, about the distancing. So, you know, if we have an open concept, it's really important that people are appropriately distanced. And the distancing is one measure, but there'll be a whole other series of measures that will be important to ensure a safe office space, like regular cleaning of surfaces in the office, lots of access to hand sanitizer, et cetera, the kind of behaviors that we've talked about that people can adopt to protect themselves. So it's really a package of things that need to be implemented to make the workplace maximally safe. Over.
Thanks, Daniel. Daniel, the next one is for you. How many tests are conducted daily in Thailand? Is there public information about this?
So we just talked with we meet on a weekly basis with the head of the Department of Epidemiology just to exchange information, and he indicated yesterday that close to 10,000 tests per day are performed in Thailand. Now, that may be, whether that's actually 10,000 individuals tested, it's probably not. There are probably fewer individuals tested because some individuals are tested on a repeat basis. But we know that test capacity is expanding in the country, both in Bangkok and the provinces.
Thanks, Daniel. What precautions should be taken while traveling on long international flights? Daniel, for you again.
Don't travel on long international flights. No, it's a reasonable question. I think that I'm hoping that the airlines will be addressing these, and that a lot of the measures that that will be required will be put in place. But again, it's all about those four basic things: lots and lots of hand washing, lots and avoiding touching surfaces as much as possible, avoiding touching your own face, sneezing and coughing properly, making sure that you have alcohol-based hand rub with you at all times, and trying to ensure, and I hope that the airlines do this, trying to ensure that distance of at least a meter, 1 to 2 meters from people around you. And I think wearing a mask in this context is a good option if those conditions can't be guaranteed.
Brilliant. That's where we are going to stop today. I think we've answered most of the questions that were posed to us. In case we missed any, we will make sure that we get the answers to you by early next week. I'm going to hand over now to Ibu Amida. Ibu Amida, over to you.
Thank you very much, Gita. I would like to thank everybody for joining the town hall. And certainly we take a note of all your questions, which reflect your concerns on how we move forward. Yeah, again, in terms of decision making, as has been informed, that every Tuesday morning, CCMT meets, yeah, its weekly meeting, and then CCMT will give recommendation on various measures or going forward, yeah, including to SMT, should there be a change, yeah, in a certain direction or policy, UN as a whole in Bangkok duty station. And third, I also would like to extend my sincerest appreciation and thanks, yeah, to all my UN colleagues across agencies for being together, yeah, in this quite challenging time. Yeah. And also in CCMT, yeah, we are together. In SMT, we are together, as well as at the working level, we are together, yeah, coordinating how to prepare, how to prevent, preventive measures, communication to staff, and also to staffs, yes, to staffs, council that also has many very good initiatives, yeah. Including the lighter one, yeah, that I shared earlier, including also how we can share, yeah, with cafeteria staffs and so on to lessen their burden. And lastly, I would like to echo Secretary General's message, yeah, to all staffs, that a few weeks ago, just before we went to a work from home modality, yeah, the night we decided to shift, yeah, to work from home modality, when we had this PTC, Secretary General said, yeah, to all staff that the key for us, yeah, to overcome the situation together is two. One is prevention. Second is flexibility. Yeah, flexibility as much as possible for staff. And this is also, yeah, what we heard from several of the questions that you posed, that we need flexibility, yeah, for staff as appropriate for staff, yeah, to be able to still, yeah, do their work in an effective manner, but at the same time also to cater, yeah, their personal needs. So with that, I would like to again extend my sincere appreciation and thanks, and have a very good day. Okay. Thank you very much. Bye bye to all of you.
Bye. Thank you very much.
Thank you.
Thank you, Ibu. Bye.
Thank you, Gita. Thank you, Neil. Thank you, everybody. Thank you, Daniel. Thank you.